the fourth episode of the Practice Spotlight podcast. We interview the greats in the field of dentistry as to give our listeners some of the latest that modern dentistry has to offer, as well as get a better idea of understanding the person treating them behind the surgical mask. We are honored today to welcome Dr. Stan Golyand. Dr. Golyand is a graduate of the University of Moscow School of Dental Medicine. He earned his degree from NYU, finished a general practice residency from Kings County Hospital right here in Brooklyn, and his practice is located in Staten Island, New York. Welcome, Dr. Golyand. How are you?
Thank you. I'm good. How are you?
Great. Thanks so much for coming.
Thanks for having me here.
So before we get into the details of dentistry, why don't you give us a little bit about background about your upbringing, where you're from, where'd you grow up?
Well, I grew up in Moscow, Russia, and I came here to the United States when I was 23. It was 1995. I was trained and licensed there, and I worked for a short period of time, actually. And then I immigrated.
Great. Fantastic.
Yeah.
And what was that like, the transition from being a dentist out a couple of years, dental school as being... dentists all know dental school is rough.
Right.
They give us a hard time in a short period of time.
Sure.
And to do that twice, I can't imagine going through that again. What was that like for you?
Well, it was not easy, exactly, but, it was fun, and it was interesting.
Great. I'm guessing probably the second time around, you have a different perspective, where first round is just about survival.
Totally different perspective.
Right.
Totally. I mean, it was, I want to say it was probably tougher here.
Okay.
Because, it was a totally different environment, different culture.
Sure.
Because I started dental school about, 2 years after I came here, less than that, which was relatively soon.
Right.
Plus, I had to prepare for it. I had to take my tests. I had to take my part on board. And I had to take my TOEFL. Back then it was called, I don't know how it was called.
Right, yeah. Right, the English equivalency the exam, yeah.
Language exam, yeah. So there was a lot of preparation. So I want to say that I started, probably like a year after I came here, less than that. So yeah, but it was interesting. It was interesting and challenging, especially comparing those schools.
Sure. How was your English back in Russia versus when you got here? Did you have much English when you came over?
I have to say I was blessed. English was something that I was interested in since I was growing up. So when Perestroika began in Russia, I was a tour guide with American and British tourists.
Oh, wow.
And I was only 15 and 16.
That's great.
So that was a huge exposure.
Of course.
To English. So I came here, language-wise, I was pretty okay.
I'm just, for conversational language, was one thing, but university level language, textbooks, everything like that is, I'm sure, a whole different animal. What was that like?
It was, there was definitely a lot of, words that I had to learn.
Sure.
But that part was not very difficult.
Okay. That was before the days of Google, right? So
it was. I
couldn't imagine how you actually have a dictionary to look up words.
The actual book. Yes, that's how it was.
And my mom is also a Russian immigrant. Came from was a nurse in Russia. Became a podiatrist here in the States. And I remember her as a kid studying, and she had a pretty good handle of English, but there's a lot of specific words that you have to translate. And I remember she had a rolling dictionary with words you'd write down and kept everything.
Exactly.
I mean, going through dental school the first round was hard enough. I couldn't imagine doing it again in a foreign language. So yeah, very impressive. Let's see, were you married when you came over? You met your wife when you were here?
No, I met my wife when I was here.
Oh, great. Okay, yeah. So you were single then, going through school?
I was single, going through school. So I didn't, compared to other guys that came here, were already married with kids.
Right.
In my case, it was a little bit easier.
Right. I guess you don't have any other responsibilities, but you also don't have any extra support. What was that like in terms of, were your parents here beforehand?
My parents were here. So that, that was a support that I had. And I had some friends here.
Great.
So, I had a lot of moral support.
That's great.
You still have to, you still have to.
Still got to do it, but right. The support team is always really helpful. Really important.
Very helpful. Yes,
absolutely, it's great.
And important. Yeah.
Did you work during school? Part-time, wow. Because NYU is not cheap.
NYU is not cheap. Thank God for,
Student loans, of course.
Yeah, which were not as high as now back then.
Right.
So yeah, but I had to do some, part-time work.
Wow. Yeah, I remember just dental school, the first, especially you say you place out the first year because they give you credit for your previous.
Right.
But still, school is second year is really challenging. And third year is a lot of clinic, and you sort of so there's not a whole lot of time hours during the day to work.
No.
So yeah,
not really. No.
A lot of dedication. Okay, that's great. What did you do during school?
Well, I was, I assisted sporadically, and
wow, it's impressive.
Some business delivery.
Oh, really?
Yeah. Well, listen, you come here.
Right.
You need to, make a living.
You listen to lectures on tape as you're delivering the pizza back and forth just to keep studying?
No, not necessarily. No.
That was your relaxing time.
No, because
there
was nothing on tapes. I mean, you had to do books.
Yeah, right.
So if you're delivering a pizza pie, you can't study it.
It's true. Okay.
Yeah.
Good. All right. Let's see. As a kid growing up, what were some of your favorite activities to do?
I've always loved playing table tennis.
Interesting. Okay.
Yeah, I mean, I still do.
Okay.
And movies.
Did you ever do anything competitively in table tennis?
I want to say semi-competitively.
Okay. Tell me about some of your fond memories growing up in Moscow. What was that like? Assuming there are fond memories growing up in Moscow. Making an assumption. You left, so all right.
Plenty. I mean, it's a beautiful city.
Mm-hmm.
It has, and we lived in the very center of it.
Oh, great. Nice.
So taking walks there.
Sure. Big cultural center.
And, theaters.
Sure.
Not just movie theaters, but theaters.
Right.
Classic theater.
Yeah.
That was actually one of the other things that I loved and enjoyed there in Moscow.
Great.
And, it's very cosmopolitan.
Sure.
It's just like every cosmopolitan city. It's somewhat similar to New York. New York is, there's only one New York. I had very good friends there.
Great.
And also great families. So it was good there.
Great. Fantastic.
Yeah, I had very good recollections.
Great. What would you say some of the early influences in your life? Who were the people that kind of molded who you wanted to become? People you looked up to, both friends, family, otherwise public figures.
My dad was definitely the number one figure that I want to say helped that influenced me and helped me become who I am now. And I still I want to say look up to him.
Sure.
In a way, even though he passed away, and but your parents are always in your life.
Of course.
So he definitely was, and I have to say is number one.
That's great.
And also my uncle who's an endodontist.
Oh wow.
In Boston.
Nice.
And he was the one that I looked at, and I wanted to become a dentist because he was also trained and licensed there before he came here.
Okay.
And became a great endodontist.
Fantastic.
So yeah.
Did he come around the same time as you, or he was there earlier?
No, he came a few years before. He's a few years older than I am. So as being like in school,
right.
I saw him going through dental school,
right,
and then already practicing as a dentist. And his mother was also a dentist.
Oh wow.
So I didn't have any dentists in my immediate family,
right. But you saw influence from outside,
right? But we were very close, so with them. So that's how I want to say got interested in dentistry.
Cool. Any other family members became dentists?
Some distant ones, yes.
For some reason, I see dentistry as a big family sort of thing. It was even. I remember when I was applying to dental school, they asked how many other family members are in dentistry,
right.
Which I thought was such an interesting question.
Right.
But then I thought, My grandmother in Russia also was a dentist.
Right.
I don't know if that had necessarily influence. I never saw her professionally. When she came to America, she wasn't practicing anymore. But then I guess.
Yeah.
And my brother also became a dentist. We came with kind of different angles of what we were interested in. Just it seems like it's a strong family organization for whatever reason. I always ask my kids, like, is this something you might want to do? So my girls are generally like, oh, it's gross, surgery, blood. And my sons just don't seem to be interested yet. They're still younger. So yeah, we'll see. But
never know.
Never know. When you came to the States, you finished at NYU. You went to you did GPR at Kings County. What was that like? Kings County has a reputation of being one of the level 1 trauma center. It's in the thick of a rough neighborhood in Brooklyn, and you get to see a lot of everything. So what are some of the interesting adventures that you were part of there?
Well, the whole year was one huge, interesting event. Honestly, well, we saw a lot. We saw a lot when we're doing calls. You get woken up 3:00 in the morning, and there's some bad trauma that was just admitted, and they need a consultation of a dentist. So we were paired with oral surgeons,
right?
And we were doing rounds with them. So I was able to watch how they examine the patient and what they do and assist them. Because there's in the residency, especially when it's this type of a tough residency, it's sort of like an army,
right? Yeah.
So in terms of its stuff, but there's also that friendship.
Sure.
Amongst
camaraderie,
soldiers.
Yeah,
exactly.
Absolutely.
Everybody's
we're in this together. We're looking at just like help each other out,
right?
Learn from each other, different disciplines of medicine.
Absolutely. So it was very cool. It was very cool, interesting, and it was a good lesson in a lot of things.
It's great.
A lot of aspects, including how to interact with people in a situation that's not exactly easy for everybody.
Right, for sure. Yeah, for me, it was also, I did a GPR before my implant fellowship, and that was one of my favorite parts about the hospital, level 1 trauma center. You get to see, and a lot of my co-residents would say, this is crazy, why are we doing this? We'll never have to do this in private practice. I'm never going to see someone with a major face laceration come into my private office practicing dentistry. I said, you're missing the boat if you can handle these cases. When someone comes in with something much smaller,
it's a walk in the park.
Exactly.
Right.
This is easy, as opposed to if you just have a background in dentistry and then something happens slightly out of your comfort zone, you're going to be thrown.
Right.
That's why I think hospitals, New York State, it's already been a long time, I think since 2008, has mandated necessary general practice residencies for dentists to be licensed in New York State, as opposed to New Jersey, and many other states don't require it. Right. Again, I hear the argument, you need to get dentists out there and working. There's some truth to that, but you become such a more well-rounded healthcare provider by doing a hospital-based residency.
Right.
It's invaluable information.
And it's a great transition.
For sure.
Because once, if you basically jump out of dental school right into private practice, you don't get that year of transitioning.
And also feeling some independence and right. In dental school, everything is very meticulous. There's a professor looking over your shoulder every minute.
Right.
With everything checked. It's not like there's not a lot of independence, and you're throwing it from that into private practice. There we go.
All of a sudden, unless you're very lucky, nobody's helping you. So
correct.
You still want some guidance.
For sure. Very helpful. It's always helpful. Always helpful. I still have guidance of my mentors in my practice.
Right.
I've been doing this a long time, and still, it's always very helpful. After you finished residency, did you go right into your own practice? You worked for anybody else?
No. I worked for, as most of the dentists do.
Sure.
I worked for a few places. 2 days here, 3 days there. So that's.
Any good mentors you picked up there? Any of those places?
I had, I had a couple of people that a couple of bosses that were good, and mostly, I want to say mostly in residency and in dental school. That's where I had best mentors.
That's great.
Yeah,
I tell people all the time, when you first start working, don't just take the what we consider the best job in terms of just pay and hours. Look for the person you're going to learn the most from right away, because those first few years are going to kind of imprint how you're going to level of dentistry you're going to practice. I know we could do a filling, but there's fillings and there's fillings that are, going to be there for a long time.
Right.
Meticulous in the care of how well things are done.
Absolutely.
Every minor detail. You can rush through things. I think, patients oftentimes will ask, like, why do things cost so much differently in dentistry? Like, I can go to this place and insurance will cover everything. And I go to this place and it's thousands of dollars for the same thing.
But it's not the same.
It's never the same. Right, exactly.
Right.
At the end of the day, you're always getting what you pay for. The person who is charging significantly more is because they're using best materials, they're taking their time with the procedure,
Right.
making sure they're doing it well, they're not rushing you in and out of the room to get the procedure done, because done just means you're leaving. That doesn't mean it's going to last.
No, absolutely.
All right, it's There's a saying in the contracting world. You can have things good, cheap, or fast. You can have two of them. You can't have three. So
Right.
you want something good and cheap, it's going to take some time. You want something fast and good, it's not going to be cheap. Right? There's always going to be a give somewhere. So, things, especially in the human body, we're not dealing with building a house. We're dealing with, adding, healing teeth, replacing teeth. These things take time. They take the body to heal. You need really meticulous procedures for things to go well.
Right.
It's going to take time, and it's going to have a cost to it, because the dentist is not rushing through your procedures, giving you all the time that they have so that your end game is going to be the best possible outcome, for sure. So tell me about your current office. How long have you started? How long have you been there for? In the Staten Island office? And
I started in 2006.
Great.
It's been about 17 years.
Fine. Wow. Same location the whole time?
Same location.
Beautiful.
Yeah.
How many staff do you have?
We have about 4 girls.
4 staff. Okay, great.
Yeah.
I see 2 front desks by hygienist and assistant.
I have front desk. I have an assistant. I have a girl who is a floater.
Mm-hmm.
She
the front desk over there. Yeah, right.
Yeah, and I also have a pillar and insurance coordinator.
Great.
person.
Fantastic. Staffing with you for a while?
Well, right now after COVID,
It's a rough go, yeah.
It's very rough go. But most of the people, I like to say that whoever stays for a long time.
Right.
I've been blessed, and I was blessed to have some of the employees work with me for 10 years, and we only had to part ways because they either had to move, my assistant that's been with me for many years. She just relocated to Florida, and that was the only reason why why she would leave. But I'm blessed. We now have also very good staff.
Great.
And that's huge, because that's your second family.
For sure.
Yeah, and,
you want to
and time-wise, sometimes it's your first family because you spend more time with them.
Yeah, absolutely.
So it's extremely important, and there's going to be a fit.
Right, for sure. Right, personalities with the dentist, personality with the other staff members,
Right.
And that creates a culture that is warm and inviting for patients. Critically important. I always find that privately owned dental offices have their own unique flavor, either decorations or things that you're passionate about that are on display in the office, things like that. What would someone find walking into your office that just says this is who you are?
Well, I think it's most of the people.
Okay.
It's a welcoming person in the front.
Right.
Knows you by name. You're not just a patient.
Right.
You're not just
Sure.
whatever. No. They know who you are. They know about your family if you've been there more than once or twice.
Mm-hmm.
It's something that you really can't fake.
For sure.
They care, and I always worked with people that care, because I can't work with somebody who's just formal. That's not what I am.
Right.
It's most of the people.
That's right.
Decoration, it's important, but if you have somebody who doesn't care,
right,
nothing matters.
Right. They say like a house is a house that's the decor, but the home is who's in it. So yeah, it sounds like a description there.
And you know what they also say about patients, they don't care how much you know before they know how much you care.
Absolutely.
And that doesn't go only for for dentists; it goes for staff also.
Of course.
So
course. Yeah, and it's one of the really nice things about a general practice is that you're able to have these relationships for decades.
Exactly.
Here we're a specialty office, so we see people more for likely or more immediate need. We see them for follow-ups and long-term checkups,
Right.
but we're not constantly seeing them. But from a lot of my referring offices, these are people who have been at that for decades and decades and decades, and that's how you know you're really working with a great team of other dentists who are working with you. I refer back my own family members to these dentists because I see their work when their patients come in, and I see that the patients have been with them for decades long, and they feel like they're part of their own family, right? It's like it's an extension of the family, which is I feel like in medicine has been completely lost. Used to be like a family doctor was like a family member, right? They would come do house calls, like that's so far gone in medicine today.
And that's such a shame.
Yeah, it is a shame because if someone's going to make a diagnosis, what you need, know you in your life is a big part of that. It's not just a blood test, and that's the answer. There's a whole background to what's going on here.
And that's what's missing. But
Right.
It's a different story.
So the fact that dentistry has still remained largely private, I think, has held on to that. And I think that's only in everybody's benefit. Great. Let's see. If you did not become a dentist, what do you think would be the other profession that would interest you?
A journalist.
Journalist, interesting. Okay. Tell me about that. Do you have some background in journalism in general, just a general interest in it?
No, always general interest in it. The fact that you can, you meet a lot of people, different people, get to know aspects of lives of a lot of people. You get to travel. If you're in a certain segment of,
Sure.
journalism, I mean, you get to travel and you get to see, other cultures.
Absolutely.
And communication, dealing with people. That's what I always love.
That's cool. Great.
That's my thing.
Okay.
Yeah.
Talk to me about, let's say, a meaningful experience that you've had with a patient interaction, somewhere where you feel like you really made an impact. So I think we all get into this career to make impacts in people's lives, but we sometimes get stuck in the day-to-day of just getting through our days and getting through the procedures. But anything you can remember offhand where you feel like you made a significant impact in somebody's life?
Well, there's, over my career, there's been quite a few.
Mm-hmm.
Just like I'm sure your situation also.
Sure.
There were a few cases when when somebody walks in the office, and let's say their front, for example, bridge collapsed.
Sure.
And it's Friday, and tomorrow there's some kind of a function, or
Right.
whatever, or
a kid's getting married or whatever.
Or traveling.
I cannot walk around like this. Right.
Yeah. And you're able to help this person walk out with the teeth
Right. Sure. It's huge.
that actually look good.
Yeah.
That's huge.
Absolutely.
And that's, I'm not even talking about when the person comes back for, let's say for the permanent restoration, because obviously, you need lab and you can't,
Right.
The whole huge bridge with, let's say,
Right. Things will take time.
Right.
But to temporize somebody and get them out the door, and something that's going to last them at least a little while until they can treat this properly. Right. Sure, that's huge.
That's huge. And I remember, there was that woman that came to me, and she had exactly that situation. I still have the before and after pictures. And, it took a couple of hours, but she walked out and, she said, well, these are temporaries. I said, yeah, these are temporaries. She said, I'm actually fine. These are temporaries. I don't need permanent. Good. And,
it'll break and you'll be crying again. So don't think that's going to be forever.
Yeah, you got to be careful with them. Yeah, whoa. But she's still my patient, and it's been quite a few years, and she referred a lot of patients.
Beautiful, right? And that's really what it is. When you treat people like people, you treat them like your own family. They're going to send their other friends and family, and those are also the kind of people you want to be treating, right? People who appreciate what you're able to do for them. There's always people who just need a treatment. They come in, they leave, and done. But the people you really have a deeper influence on, I think that's why a lot of people have gotten into dentistry specifically.
Yeah, because you get that thank you, and that's
Right, it's huge.
Yeah, I don't want to sound cheesy, but it is.
Of course,
you can't put a price tag on
right.
that.
So I think people also realize we're first and foremost, we're professionals. We treat people whether they're going to be kind to us or not. We're trying to treat everybody the same,
Right.
Always. But we're human beings, right? Of course.
Exactly.
Same as you would like a compliment, right? That your dentist, your doctor, anyone you interact with in life, of course, would like you to say thank you and say, I appreciate what you do. Be it a waiter at a restaurant, you got to clean the hallways at a hotel, right? It's another human being here. This has their own life, their own world. A kind word to say to somebody, we always say it to our patients, but it always works both ways also. Your interaction with another person always helps to be kind and generous and just, be a real human being with people. Always helps. So that's the fun part of dentistry, but dentistry, as you know, is sometimes a little bit challenging. We work long hours. It's super meticulous, the kind of work we need to do. We're really hard on ourselves to make sure we're hitting that level of perfection consistently. So I'd say, but you find one or two things that you find most difficult about the practice of generating, either the clinical part, the running a business part. What part do you find some of the more challenging parts?
I want to say that probably the combination of combining clinical part and business part is probably the most challenging combination that you can have in life.
Right.
Dealing with people is both fun, but sometimes it presents challenges. And I want to say that nowadays, the toughest part is what happened to medicine. In a way, and the key word so far, thank God, is in a way, but is somewhat happening in dentistry,
right?
In a lot of offices, and I want to say that overcoming that, I have nothing against McDonald's, but overcoming that McDonald's type of corporate dentistry and approach is a huge challenge.
Right, absolutely right. We don't want to turn dentistry into a commodity. We want to have it streamlined as possible. I think technology has helped tremendously with that, to streamline things, make things better, faster, and less expensive. Overall, obviously, the technology's fees are very high, but after you do those procedures enough times and it pays for itself, you're able to offer that as reasonably as possible. But when things become too streamlined, and then you're just a number being pushed into that stream, and you're just flowing through there, you never see the same doctor twice, it just comes in and out. Again, you lose so much of that really important part of diagnosis. I've had a number of patients come through and say, I went to X big corporate office, and they gave me this, they bring the treatment plan of what's being done. Like, it's a super aggressive treatment plan. You're treating a lot of things that, if I know you and I know your background and I know how long these things have been going on for,
Right.
We look at this very differently than just, you need X, Y, and Z procedures because I just met you today.
Exactly.
It's never just like that. You need a real diagnosis first, and then the right procedure, even though it's a good procedure for someone, that might be not a procedure for you. And sadly, sometimes these bigger offices just see people as they're coming in, they're going to be a number. I've got to maximize that number for this business, and that's what it turns into, which we, again, never got into this field for that. We want to give people the best care possible with the right care that they need, not just the right care for, a business perspective. So I hear that. It's like just combining the business part. We got to run a successful business. Have families to take care of, but at the same time, we're also taking care of people. Those two should never come into conflicts, right? We should be doing good enough, excellent dentistry, providing excellent care with fair fees that will both provide for us and provide for our patients. It should never be too much. When people I think it's when greed sets in, and I just want to charge as much as I can, make as much money as physically possible. You're going to have to give. That's where it changes for sure. Yeah, I would agree. It's one of the really, really hard parts. And then on the flip side, what's your favorite procedure that you do? Something that, let's say, put the person of it aside, this X number of people need this procedure. What's the procedure you enjoy the most?
I do love doing root canals.
Right.
I do love placing implants and doing oral surgery in general.
Fantastic.
And I enjoy cosmetics, veneers and cosmetic crowns.
Great, fantastic. Right, so get people out of pain, replace teeth that they're missing, and make them look good in the process. That's right. That's why we do this.
Pretty much, yes.
Exactly. Yeah. You got it all in that one. Some of the dentists love buying the latest technology. We're very into just doing the best all the time. So, but sometimes it blows up in your face, and this technology that's just doesn't work as well as we wanted it to. But there's some stuff that works really well. What are some of the purchases you've made in the last couple of years that you've either loved or hated or somewhere in the middle?
I'll talk about the ones that I love.
Great.
And I want to say the CT scanner.
Sure.
Because that opens huge possibilities. You can actually see the three-dimensional human being, and we're all three-dimensional. And sometimes, when we're all trained looking at the two-dimensional image, which is an X-ray, which only shows two dimensions, if you think about it.
Right.
But, since we're three-dimensional, when it comes to, let's say, placing implants or even doing root canals, you want to see that very dimensional.
Yeah, absolutely.
Because otherwise you're missing a lot.
Right.
And CT scan gives you that possibility. And that's a really wow.
Yeah, it's one of the greatest advents in dentistry is that now when it's opened up and it becomes reasonable for a general practice to have a CT scanner in their office, you're able to see so much more and diagnose so much more earlier, diagnose it better, making sure that you're really making the right clinical decision, that otherwise you're making a strong, educated guess without all the information that you could have.
Right.
Nowadays, this is all the information you could have, and I'm sure as time goes on, things will still obviously continue to improve. A lot of new gadgets that we feel like we can't live without with either, but it's only going to increase patient care and make things better because, so often I'll take a CT scan prior to an implant surgery and we'll find something else unrelated to why they're here, but great, we found it early before it became a big mess. Symptoms start much later when it becomes a big mess. So to diagnose things earlier, catch things early, it's a huge, huge help.
Speaking of that, I just had a patient a couple of days ago, and she was complaining about a tooth, and root canal tooth, and nothing seemed wrong with it. And I said, you know what? Why don't we take a CT scan and look into a three-dimensional image, and maybe we'll see something there. And we did, and I saw that there was an issue with her sinus. She had, a lot of fluid in her sinus, right on top of the tooth.
Which can present as dental pain. And, if I didn't have that equipment and the ability to... Yeah, I can't even imagine how many root canals in the history of root canal therapy have been done misdiagnosing with good intentions.
Exactly.
Because it's the same nerve that runs across the sinuses, that innervates the teeth, that innervates the sinus. So when you have pressure in your sinuses, it could present and your brain feels like it's tooth pain when it's not really tooth pain. And someone's in agony and you won't feel like you're going to help them. So you do the root canal and it's like, it's not any better.
Right.
Oops.
Right. Yeah.
And again, right. Let's do another one, right? If you got the wrong tooth, let's do another tooth.
Yeah.
It could be a mess before it was just simple. Not a simple X-ray, but a more comprehensive X-ray can give you a lot more information to diagnose this better. And again, it's a great procedure for if you need it. If you don't need it, you don't want to do this procedure.
Right.
To diagnose things properly, you get the person the best care possible. Yeah, it's huge. I see the internet loves sharing life hacks, things that they do that's tips, secrets. They learn to make things a little bit easier. Do you have any life hacks that you've thought of that you do that are, say, when you think to yourself, not too many people know about this, but this really helps my life out. Something like around those lines.
It's usually small things.
Right, it's always small things.
That play a huge role. Using that occlusal clearance stick to check if there's enough clearance.
Right.
When you do the crown prep, when you prep the tooth for the crown, instead of looking and trying to see what's there. Somebody came up with this brilliant idea of that clearance stick, and that helped. That really helps a lot. And it's just a small stick.
Yeah, exactly.
And you look at it and you think, how come nobody
right
came up with it before?
Right.
It's so simple.
But it helps helps me so much. It can make sure that I reduce enough tooth that the crown will go in properly, but not too much that now we've taken more tooth away than we needed to. It's not as strong. Small things like that, right? They make a huge difference.
Exactly, they make a huge difference. Or, that thing I was taught, that little thing to make it temporary, you just use a blue mousse bite registration material.
Copy the tooth before.
Instead of taking an alginate impression, which is messy and it shrinks. This thing takes a few seconds.
Set, right? And then you can put it right on top of the crown before. Faster, stronger, better, and that's for everybody.
Exactly. And those are the things that you learn from your mentor.
Right, for sure.
Right, because you walk out of dental school, or when you're in dental school, you think everything has to go by the book.
Right, there's only one way to do things.
Right, exactly.
They tell you how to do it, that's the only way to do it.
That's the only way to do it. And sometimes those ways, they're antiquated.
Right, sure.
Really. Nobody reviews them, and they go from generation to generation, and until somebody comes up with a occlusion stick.
Exactly.
With a clearance stick. So that's
Yeah, I think a lot of dentistry also is so much of innovation. I think we were also ahead of the curve, even in medicine. A lot of times, is that because we're somewhat privatized and not dictated by insurance nearly as much, is that something can hit the market and get utilized very quickly, and really start to go into the field of dentistry much, much faster than it would in medicine. It helps patient care tremendously. And we oftentimes we'll get asked like, hey, this procedure was not inexpensive and you finished it so quickly. It seems like it's not fair, right? Why are you charging so much for a procedure that took so quickly? And I'll always answer them, because we've invested a tremendous amount to get it done quickly.
Right, exactly.
We can sit here for a long time and get you a lesser result. Exactly. Lesser result, absolutely. But we lean on this technology and years of clinical training to do the best way possible to get you in and out as efficiently as possible.
Right.
That's not going to be less expensive always. Sometimes it can, if we do it so many times, if we can be less our overhead, so we can make it less expensive. But oftentimes it's because we've had to invest tremendously in technology that allows us to do things like that. Yeah. And it's going to make things more, not less. Flip side of the things we love about dentistry, dentists are notorious for overworking ourselves, right? We work crazy hours. It is physically very taxing. Mentally can be draining. What are some of the things that you do to keep yourself fresh and keep your stamina up, so you can bring your best self to your office every day?
Both physical and mental. Physical, you exercise. I play table tennis. That helps me. I wish I could play more often.
Sure.
But I do play, and that helps me completely phase out and forget about everything.
Right. I just let your mind relax. Right?
Exactly. Yes. And the other thing is, it's your family and it's your friends.
Right. Yeah.
Yeah. That's what brings comfort, and spending time with them.
Yeah.
That's precious.
Yeah. One thing I didn't realize getting into dentistry was how physically taxing it was. I never realized. And then I started having back trouble. I remember even in school started a little bit, and then as it just that after practicing dentistry for a while and then going to play basketball, which I loved doing back then, the after effects were not good, because my body was so out of shape of doing an active role when I'm sitting in one place all the time doing this, and also putting stress on my back, leaning, things like that. So I even until recently started exercising more, which is good, but it wasn't even still quite enough. I even recently, a few months ago, I had a major back spasm. I was laid out for like 2 weeks. I couldn't move.
Right.
I'm 43 years old. I shouldn't be like incapacitated, but like I was like out, could not move. And when I finally was, I would take little baby steps. I felt like I was 85 years old in bad shape. So I realized that's
quite a feeling. Huh?
Yeah, correct. Yeah, it's, and thinking like I got a lot of years left to do this. I got to make sure that. So I got myself a trainer, and specifically came highly recommended from a physical therapist, and said you got to work specific muscle groups and make sure you're working things that your functionality outside of dentistry makes you strong enough for dentistry itself. And it's made a huge difference. I would highly recommend it to any dentists or really any professionals who will like take a physical toll. If like any profession you're in is going to take some sort of physical toll.
Right.
And
but
it
you
just
have to say is
Yeah,
the
that's what I'm
right
saying.
way.
Correct. And I think that was the biggest difference. I was exercising for years, just doing something. I was running a treadmill, I would do some weights. I didn't have a plan, right? It was more just like very amorphous. I'm exercising. And that was for the amount of time that dentistry takes is a big accomplishment. But it's not. But what was I found tremendously helpful is that when you have a specific plan of a expert in a field that says, okay, I know you, this is what you do, this is your physical ailments, these are what it's contributing to it. Let's develop a plan to get that done. I found I'm spending less time in the gym, getting much more efficient, and thank God, pain-free since that's happened. I gave up.
Same thing as in dentistry.
Yeah, I mean, absolutely.
He's an expert in what
same idea. Right, so you got to lean on people who know what they're doing in different fields.
Right.
You can go on YouTube and learn stuff, right? Like in anything, but
that's so generic.
Exactly.
That's for everybody.
They're giving you general. I've spent countless hours researching. I'm like, I'm in the medical field. I should be able to find out what's wrong with my back and that. No, again, someone who really knows this, right? That's why we always say, like, don't confuse your Google search with my medical or dental degree, right? Same idea. Don't confuse your general knowledge with a Google search that you think will put everything together. Lean on people who really know they're doing this stuff, and they're really able to help you. So I found that was a huge help. And what happened was I'm now much more efficient with my workouts. I'm not working out nearly as much. But when I am working out, it's super efficient, and I'm working the kind of muscles that I need to give me balance and stability when I'm working. And just last week, I hadn't played basketball already in a long time because I thought I can't. I'm too old on it. And he said to me, he's like, you're good. You can play basketball. I'm like, are you kidding me? You're crazy. He's like, no, give me. He gave me some jumping exercises to do for a couple of weeks to be sure that I could, take the jumping up and down and not hurt my back on it. And the first time I played, I was like, this is nuts. I'm going to hurt myself. And I was at a pickup game. I was played against a 20-year-old kid. I'm like, this is going to be horrific. I'm going to break my ankle. I'm going to do something terrible. And I played. It was pretty good. Yeah, I did it.
Yeah.
It was great. So yeah, I would say it's leaning on professionals for specific things. It was a real lesson to me. Like, I'm now evaluating everything in my life. Like, what am I doing? What am I not doing as well as I could be doing if I got help from people who really know what they're doing with this stuff?
Yeah.
I'm thinking about it financially. I'm thinking about it just otherwise I've been getting by. But until a crisis happens, sometimes you don't think to take it to the next level. That's what I do with my back, and yeah.
You delegate it to the professionals.
Absolutely.
Instead of trying to figure out things that you can't figure out. Yeah.
Correct. Which again, could you sometimes get lucky and you can, but go to someone else who's doing this and get some help.
When it comes to your back and you're a dentist, it's not
100%. And dentistry also, stress-wise, I know it's a issue that used to be taboo, but I think it's pretty open. Now is people, you need to talk to somebody sometimes. Therapists also really helpful to get a lot of stuff, the stress that we deal with on a daily basis. Yeah. Speak to people, just like lean on professionals that can help you. No reason to suffer. We tell our patients all the time, right? Like, I get people here in surgery. I've been walking around for 20 years with failing teeth. I'm always in pain. I'm always embarrassed. Why are you doing this to yourself? Go to a professional and get help. They will help you. They're not here to expose your flaws. They're here to see what's wrong and diagnose you and get you the best treatment possible. And I get all the time. I'm sure you do the same. Yeah. Why didn't I do this 20 years ago? I am so much happier right now, right?
You hear that from people.
100%. It's always, so I encourage anyone who's, listening and thinking about different dental procedures I've thought about doing, and I'm too embarrassed to go in. Like, this is what we do. Right. No, we're not shocked when someone comes in and says, "Oh my God, you've never seen anyone this bad." Yeah, we have. And the people who are worse than you don't even know it. Okay? If you know you've got a problem, you're already way ahead of the curve.
Yeah.
For sure. What are some of the common myths about dentistry that you hear from your patients that are completely untrue?
That, let's say, implants are painful.
Right. Yeah. You would think.
Root canals are very painful, and they don't last.
Right. Yes.
Things like that. So, I think I can understand where it comes from. It comes from the days where those things were painful.
Sure.
Because we didn't have all the techniques and all the technology and all the advancements that we have now.
Right.
So, the grandmother would tell somebody,
I have a root canal.
I have a root canal.
Don't do it. Yeah.
I have a denture. None of them work. This is what you need. And you don't have good genetics, so you're doomed. Which is another myth, by the way.
Huge myth.
Huge.
I have bad genes.
Exactly.
No, you need a toothbrush, you need dental floss.
Right, exactly.
Start
and
with that.
6 months visit.
Yeah, exactly. It covers
That's
that. Exactly. Right? What we say, if everyone went to the dentist every 6 months, brush and floss every day,
Would have been out of business.
half of us would have to retire because there wouldn't be anything to do.
Yeah.
Right? So if this is you're listening, just do those things and you're going to be good at the things that you need. We much prefer to fix small problems than to do massive overall problems. We do this when we need to, but we're much happier having healthy patients come in and get treated. Right.
Absolutely.
For sure.
Yeah, so that's a myth. Yeah, they hurt. Well, they actually either don't hurt or they hurt much less
than going through the pain of not getting treatment. Right.
Yeah.
For sure. Let's see. Speaking of which, we say that genetics plays such a strong role, but we know overwhelmingly, although there's some genetic component, overwhelmingly it's just a matter of self-care. We talk to our patients about limiting your sugar intake and things like that to make sure that you're not overwhelming your mouth with the amount of sugars that human beings have never seen in the history of mankind. True. That being said, we all have our indulgences we like to take. What are some of the favorite foods that some of you tell our patients maybe you shouldn't have that too often that we occasionally will enjoy?
Well, chocolates and sweets.
Sure.
Pastry.
Right.
Things that most of people love.
Absolutely.
Those are the things. It's just you need to know when to stop.
Absolutely.
That's the thing.
And also how to be able to take it in a healthy way. Chocolate's not a bad thing. Chocolate's great, right? Candies are great in moderation, and realizing what's going on in your mouth. So,
and preferably dark chocolate because there's less carbs in it.
Right. Yeah. But I think people also don't realize. I talk to my patients about the amount of time that the carbs are in their mouth for being much more important than the amount that they're taking in. Sure, if you're taking a massive amount, it can do damage to your body in general. But I get constantly people who are coffee sippers at their desk at work. They have tons of sugar and cream in their coffee. They're sipping it all day long, and what happens in your mouth? The acid levels go up. As soon as your saliva kicks in and starts to lower it. It gets it lower, and then you take another sip. And now so you're staying at a high acid level all day long. You're going to get a ton of cavities. You're going to lose a lot of teeth. It's going to cost you thousands. You think Starbucks is expensive as it is. It will cost you so much more in dentistry. Right? So a simple little piece of advice like that, when you go to your dentist regularly, will tell you, hey, what's going on here? Why is this happening? It's not because you have bad genes. It's because you have a bad practice. And we can easily correct. Take a sip of water in between, and that is not an issue.
Right.
So small thing. Save you thousands and thousands. So with dentistry is expensive when you're not taking care of yourself, but if you're the care of a great general dentist, a lot of those things go away.
Sure.
Great. Let's see, anything I haven't asked you that you'd like to discuss?
I can talk all day long about life and dentistry.
I hear it, right? That's what happens. Dentists get together at parties. We always congregate to each other, and we will talk endlessly. I think every profession is like that. The lawyers get together, the physicians get together,
Probably,
the school teachers that get together, just you talk shop. That's what we do. So whenever we have these conversations, it always feels like it go on forever. But we all got patients to see, both today and going forward.
That's right.
So let's see. Tell our listeners where is the best place they can reach you.
Call the office, which is 718-948-6500.
We'll post it in the comments below.
Yeah, that's just give us a call, and you're not going to be hearing any recordings.
Speak to an actual human being, right?
Right, you're going to speak to the actual human being, and just come over and visit us.
Great. I'll ask you last question is with your first patient intake, tell the audience what that's like in your office.
That's a great question, actually. We're huge on asking and interviewing people over the phone about what actually the problem is.
Right.
Because that helps tremendously to understand what the patient's coming in for and what we should be prepared for. So we, as opposed to a lot of offices where, it's a 5-second phone call and
come in, we'll take x-rays, we'll do a cleaning, we'll do this and that, and then maybe we'll figure something out.
Right. We do ask, what's the concern? What's the problem? Is there a pain? How does it hurt? Where does it hurt?
Is it emergent that you'll need treatment today? Or is this you've been thinking about coming to a dentist to address a number of needs, and let's sit and have a conversation first so we can diagnose you first, then we'll come out with treatment.
Right.
But I think a lot of times people will come into the office, they're expecting treatment today, right now. Again, that's buying a commodity. We're diagnosing you first. We're giving you an idea of generally what are the options out there to address your specific needs, and then we'll come up with a plan.
Right, and sometimes the other way around, that the person needs care right here
emergency
now.
today.
Right.
So we've got to be able to book you the right amount of time for that. So we don't just send you back home with a prescription. If we can do something for you today, we want to know that so we can get moving. Absolutely.
And we're huge on that.
Yeah, absolutely. And I think that just will come to the individualized care rather than just like come in, I need cleaning and this. Sometimes, a lot of offices won't do cleanings in the first visit because I first want to get to know you and what kind of cleaning do you need.
Right,
cleaning is also not a commodity. I think people don't realize that.
It's not just one type of cleaning.
Right. It's like sometimes people have some gum issues going on. You need something a little more specific. Sometimes you're going to get numb for your cleaning. That's going to require some time. So the first visit is really just to get to know us. Patient gets to know us. We get to know our patients. What are your needs in general? And then we can proceed to go forward. So I think also for some people who are scared to come to the dentist, it helps because we're just talking today. Right? Like we're just going to figure out what we need. Nothing's going to hurt. Nothing's going to be uncomfortable. Get you comfortable in this office. Then we'll talk to you about what we can do for you in your given situation.
And I've had quite a few patients like that, by the way, that were petrified of dentists.
Absolutely.
And, it took some time to actually make this person get at ease, trust you, and, then start the treatment.
For sure. Okay. Well, Dr. Golyand, it's been fantastic. Thank you so much for coming down.
It was great. Thank you very much.
Okay. Thank you again.